Many clinical trials focus on testing new medications, but this Breast Cancer Awareness Month, the University of Vermont Cancer Center is spotlighting a trial that actually removes a commonly used treatment for early-stage breast cancer patients.
Here's NBC5's Anna Guber with the story.
In 2024, Northern New York woman Diana Padron got the news no woman ever wants to hear.
When they did the scan, they did find a lump there and were able to do the biopsy immediately.
Just days later, Diana was diagnosed with stage 1 breast cancer. Assuming she'd need chemo and radiation, she began preparing for the fight ahead.
I had checked into different options, the hair cap, the capping, wigs, that type of thing.
But then Diana's doctors at the University of Vermont Cancer Center gave her another option, a chance to join the Offset clinical trial, a national study exploring whether chemo and radiation are effective treatments for early-stage breast cancer patients.
For these patients that are eligible for the Offset trial, it's really unclear how much added benefit chemotherapy has, and that's really what this study aims to explore or better understand.
Oncologist Dr. Carol Landry at the UVM Medical Center says qualifying patients must be premenopausal with early-stage breast cancer. If a patient agrees, they're randomly assigned into one of two groups, those who receive chemo and radiation before hormone therapy and those who don't, allowing researchers to measure the benefits, if any, of these treatments.
When I say benefit, really what we're hoping for is further reduction in the risk of the breast cancer coming back.
Diana ultimately took a chance on the trial.
They chose for me not to have to complete the chemotherapy.
Dr. Landry says it will take years before the results of the study lead to conclusive results. But for now, Diana says her scans are clear, and as her doctors continue to monitor her, she just hopes her participation in the trial means sparing women like herself from the grueling side effects of these aggressive treatments.
I was hoping to be spared the side effects of those types of treatments, and if me participating helps other people not have to go through that, it's worth it.